Let's make anemia easy for all of you. First, log the master classification. Microcytic, small cells, normocytic, normal size cells, macrocytic, large cells. Best memory line, micro small, normo normal, macro massive. That one line is your first mark. Next, the best mnemonic for microcytic anemia. TAILS, thalassemia, anemia of the chronic disease, iron deficiency, lead poisoning, sideroblastic anemia. These are the classic high yield differentials for microcytic anemia. Iron deficiency and thalassemia are among the most common core examples, while anemia of the chronic disease can be microcytic or normocytic. Student line, microcytic, think TAILS. That is probably the most useful exam mnemonic in this chapter. Next, the easiest way to remember macrocytic anemia. Split it into megaloblastic and non-megaloblastic. Macrocytic anemia is commonly divided this way in standard references. Megaloblastic, think vitamin B12 deficiency, folate deficiency. Non-megaloblastic, think liver disease, alcohol use, hypothyroidism, reticulocytosis or marrow response, or some marrow disorders. Macrocytic anemia classically includes folate deficiency, alcohol use, liver disease, and other causes. B12 and folate are the major megaloblastic causes. Mnemonic, big cells need B12 or B9 first. Easy memory, macro is megaloblastic until proven otherwise in exams. Next, the easiest way to remember normocytic anemia. Think of three big causes: blood loss, acute hemorrhage, hemolysis and RBCs being destroyed. Underproduction, kidney disease, chronic disease, marrow issues. Standard classification lists the blood loss, hemolysis and decreased or ineffective erythropoiesis among the major anemia mechanisms, and normocytic anemia commonly includes chronic disease and kidney disease. Mnemonic, normo is equal to bleed, break or bone marrow. Okay, that solves many direct MCQs. Next, the smartest exam algorithm. When you see an anemia question, step 1, look at MCV. Step 2, put it into microcytic, normocytic, macrocytic. Step 3, use the memory bucket. Micro is TAILS, normo is bleed, break, bone marrow, macro is B12, folate, liver or alcohol. Step 4, then look for clue words in the stem. This is how exam setters want you to solve it. Next, iron deficiency anemia, the most tested one. This is the first anemia students must lock. Quick clues: microcytic hypochromic pattern, fatigue, pallor, pica, koilonychia, chronic blood loss, poor intake or increased demand. Iron deficiency is classically microcytic and anemia symptoms commonly include fatigue, weakness, pallor and reduced exercise tolerance. The best memory line: iron deficiency is equal to small pale cells. Mnemonic for the clues: pale, pica, plate, periods. Next, B12 versus folate, the classic trap. Both can cause megaloblastic macrocytic anemia. The key difference: B12 deficiency can cause neurologic signs. Folate deficiency does not classically give the same neurologic picture. Memory: B12 hits the blood and brain because there are blood changes and it has a neurological involvement. Folate fixes blood, not nerves. This single contrast can solve a huge number of questions. Next, anemia of chronic disease. This is a frequent confusion point. Quick rule: can be normocytic first, sometimes microcytic later. Merck describes it as typically microcytic or normocytic with low reticulocyte count. Memory: chronic disease starts normal sized, may become small later. This is a very strong elimination trick. Next, reticulocyte count, the hidden key. A reticulocyte count helps show whether marrow is making enough new red cells. Easy rule. High retic, marrow is responding. Think hemolysis or blood loss. Low retic, marrow is not responding well. Think deficiency, marrow failure, chronic disease or kidney disease. Memory line. Retic high, cells are being lost. Retic low, cells are not being made. This is one of the smartest exam shortcuts. Next, symptoms of anemia, easiest revision pack. Common anemia symptoms include fatigue, weakness, lethargy, shortness of breath, reduced exercise tolerance, and sometimes syncope in severe cases. Pneumonia, tired, pale, breathless. Or low hemoglobin is equal to low energy. Very simple, very sticky. Next, WHO style basic definition shortcut. WHO states anemia is a condition in which red blood cells or hemoglobin are lower than normal. WHO also notes the hemoglobin cutoff varies by age, gender, pregnancy status, smoking and altitude. For sea level reference, WHO commonly uses less than 120 grams per liter, 12 grams per deciliter for non-pregnant women and less than 110 grams per liter or 11 grams per deciliter for pregnant women. Easy line. Anemia is equal to not enough hemoglobin to carry oxygen properly. This is the simplest conceptual definition. Now comes the common MCQ traps. Trap number 1. Forgetting to classify by MCV first. Fix. MCV first, panic later never. Trap number 2. Mixing B12 and folate. Fix. B12 is equal to blood plus brain. Folate is equal to blood only. Trap number 3. Forgetting anemia of chronic disease can be normocytic or microcytic. Fix. Chronic disease is equal to normal first, small later. Next, trap number 4. Not using reticulocyte count. Fix. Retic high is equal to loss or destruction. Retic low is equal to poor production. Next, the best oral chant for students. Say this daily. Microcytic is tails. Normocytic is bleed, break, bone, marrow. Macrocytic is B12, folate, liver, alcohol. B12 hits blood and brain. Retic high means response. Retic low means low production. Extremely useful and helpful. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.